This is Vet Tech Life. Welcome to another episode. On this video, we'll be discussing exam room check-ins and what points to hit to make sure your clients are informed about the most important healthcare info relevant to their pet. Now, the way I got started checking in pets in exam rooms was to basically follow another technician, saw how they went about checking in a patient. So basically what they did was hit key points to make sure, the owner was informed of everything they needed to know and what was relevant to their pet. And sometimes you need to basically, if their pet's sick, you're not going to really go over things like, flea and tick prevention and stuff like that. You want to get the doctor in there as soon as possible so you can get the relevant information for that exam room. But for everything else, like regular annual exams, you're going to want to get that relevant information, like vaccine history is very important. So a lot of key points you want to hit on to make sure the client knows exactly what's the most important information they need to know and when they need to know it. So let's go ahead and look at a few key points. So some of the key points I like to hit on are basically the vaccine history first and foremost. Like I said before, is very important because you don't want a client to miss their pet's vaccines and their pet end up getting sick just because you didn't follow proper vaccine protocol. That's something that you want to always hit on. Flea and tick prevention is another big thing because flea allergy dermatitis, also known as FAD, is very relevant, and it also is very common to what's going on in flea infested areas. One of the things also that I can't stress enough is weight and temp is one of the things that is really basic, but if it's missed, it drives the doctors very crazy. A lot of doctors I work with, this will drive them nuts. If you don't do a weight and temp, they will not want to see the room until that's done. So that's something you want to make sure you have. Also, if they've been vomiting or diarrhea, you always want to go over that because you don't want to miss that, because that's something that could be very relevant to the room. If it's a puppy, it could be parvo. If it's an older dog, could be some very gastric enteritis problem, or even some gastric enteritis problem or something very serious. So you want to get that info to the doctor right away. Another big point I want to hit on is dental care, which is a whole nother discussion in and of itself. We'll go over that in another video, and how you want to discuss how relevant it is, because tartar and gingivitis can kill, and that's right, people, it can kill, because it can cause heart valve disease, heart problems later on, a lot of things that can kill the pet. So you want to inform the owner of the importance of dental care, but we'll go over why that's important in other videos. Another thing you want to check is cataracts, and pulse, respiratory rate is always good. You want to check the mucous membranes to make sure they're pink, or if there's dark colored membranes, you want to check the tongue color basically, or anywhere you can see if there's pink. And once you press that, it should go from pale back to pink within a second or two, and that's normal, and you want to note that so the doctor knows about it. And basically you want to get a good as accurate as you can patient history, because sometimes a client will tell you something that they're not telling the doctor, or vice versa, and you want to make sure you don't miss anything. So that's a few tips. So if you guys see anything I've missed, go ahead and leave a comment, and I'll go ahead and reply, or we'll go over a few things in the next video. But anyway, thanks for stopping by, and we'll go ahead and see you in the next video. This is Vet Tech Life. Later.